Good afternoon and welcome to Bariatric Friday. My name is Kemal, Erkan. Bariatric Friday is the only weekly healthcare show in the state of Delaware, perhaps maybe in the Mid-Atlantic region. So, of course, when we discuss healthcare, we definitely need to have one of our clinicians with us, and Dr. Irgau is that person for us. So, Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's always great to be here on this wonderful show on Bariatric Friday.
Thank you. And our goal is to have a really good blend of the knowledge and expertise in this show. It's interesting in a way that I went through a couple of our patient feedbacks in the last several weeks. So we talk about people going from size 18 to 8. So this is real and it's not a paid promotion. So another patient went down from 276 pounds to 125 pounds. And they share these in our support group on Facebook. And you mentioned a patient who lost 130 pounds in 6 months.
Yeah.
So yet there is still hesitation among those who are struggling with morbid obesity. And although ASC, American Surgery Center, as a bariatric program, we have a really high completion rate, which is about 74%. This is not the case for most of the other programs. And in fact, latest studies show that it's about 55%. That means 45% are dropping. In our program, that's about 25%. So because we know that solution is there, the bariatric surgery is the most effective solution to morbid obesity, yet we still have these issues when patients are dropping. And that's heartbreaking, I can tell you. So it's almost, it becomes a little bit personal for me when I do daily case conferences and I go through these patients and see 12 to 15 checkpoints, like the cardiology initial visit, echo completed, EGD completed, psych completed, home sleep study completed, PFDs and x-rays and nutrition classes, boom, all of a sudden everything is ready, and then we are 2 weeks away from the surgery and patient wants to close the case. Now, I mean, someone may see that as, well, because it's his business. Yes, of course, like, I'm not going to lie to you, it's my business, but what my business is doing is helping others. So when I'm not successful, that means other people are not getting healthier, right? So that's why it's heartbreaking. So, and maybe that's one of the best reasons for me to be in healthcare, because when you do your work really good, then yes, you benefit, you have financial benefits, but you have other benefits to the society, to the community that we live in. So that's why it's always, it's almost like a pleasure to be in healthcare from every different angle. So Dr. Irgau, why do we drop, why do patients drop at the last minute? What happens? So if you can just explain those to us, maybe we can be able to reach out to some others who are at that point so they can understand what's happening with them, and then hopefully we can reach out to more people.
Sure. It is a very important question, okay, Kemal, because to begin with, the number of people who are seeking bariatric surgery for the treatment of morbid obesity is actually a minority, right, compared to the people who actually need bariatric surgery. If you look at the prevalence of morbid obesity in our society, it has been increasing, right? It is one of those diseases that have become more prevalent every time we look at the data, year after year, decade after decade, right? And yet, currently, particularly for obesity that has really gone extreme, the best treatment we have is bariatric surgery. And it's also a time in which we have made bariatric surgery really a very, very safe endeavor, right? With the quality programs that we have put in place, and also with the evolution of the surgery itself that has gone from being a surgical procedure that required a big incision for which patients had to be admitted in hospital for several days. Now it's a procedure that is done with very small incisions, and very often, like in our program, it's an outpatient procedure. So you've got the right treatment, you've got a worsening disease, and yet the amount of patients who seek the procedure is very small. And then even after that, once the patients go through the consultation, as you correctly said, not everybody completes the program. Now, having said that, your program, as you know, Kemal, would be the one that should complete the list, because you've got a completion rate which is one of the highest in the country. We were reviewing this data not too long ago with our surgeons, and a completion rate that is close to 75% is unheard in many places. It's usually you see about 50% of the people who go into the program completing, and in the vast majority of programs. Nevertheless, it's important for us to ask these questions because we do want people to get help. Now, the first thing that we have to obviously clarify is that this is a decision that patients have to make for themselves ultimately. What we do is we provide the right information, we provide the guidance, we provide the recommendation, but ultimately it's up to the patients as to whether they want to complete the program or not. And of course, that is a given. The question for us is that, you know, they've gone through the program. It's not that they have resolved the problem, right? The problem is still there, and yet they have not completed it. So what are the barriers? What are the problems? Well, in part, as we've said many times, you and I, there is this huge stigma about seeking treatment when you have morbid obesity. It's not like other diseases, right? You don't feel any type of embarrassment in saying you're going to see the doctor because you have diabetes. You're going to see the doctor because you've got high blood pressure. You're going to see the doctor because you've got cancer, right? On the contrary, people will cheer you up for doing that, right? But when it comes to morbid obesity, somehow people look at you and say, why were they not able to take care of it themselves? And this stems from the fact that our society still hasn't come to terms fully with the fact that obesity is actually a disease, right? They look at it as a self-inflicted problem that should be solved by the problem in their by the patient in their closet, right? And far from the truth, right? You and I have encountered patients who are so successful in life in many areas, whether it's education, whether it's work. They've set out to accomplish something and they've done it. And yet, when it comes to obesity, they are defeated. They cannot do it. And they cannot do it not because they don't have enough willpower or finances or trainers or guidance. It's because this disease is extremely difficult to tackle. That's why we're resorting to changing the anatomy of the digestive tract in order to combat it effectively. So the stigma associated with morbid obesity still is playing a part. And we see it in our patients as well. How long does it take for a patient to decide to come for a consultation? Well, usually, on average, it takes about 2 years. It doesn't take people 2 years to go to their doctor once they find out that they have diabetes, right? And yet for morbid obesity, that's how long it takes for most people. Now, that is one part. The other part, obviously, is probably a lot of the obstacles that are placed, particularly from insurance companies, so that people don't really have a straightforward path towards bariatric surgery. Yes, there are preparations that are very necessary, that we recommend: education, right? Clearances, all those things, but they could be done in a much more efficient way if there were not too many obstacles placed by some insurance companies as well. So all this really, in my view, conspire to decrease the number of people who ultimately end up having surgery after they see bariatric surgery. Having said that, our program really should be extremely proud for what we do, which is particularly the case conferences and the associated processes that we have put in place, help our patients, guide our patients to the extent that we have increased the completion rate to the levels that we have currently.
Absolutely. So I think let's actually talk about the insurance barriers, right? So in the state of Delaware, I think we are lucky that our Medicaid programs are extremely efficient to a point that they are the frontier of these types of coverages, and we don't have any issues with Medicaid. So just like any other insurance, any commercial insurance, Medicaid and managed care organizations, they are covering this, and there is no cost to the patient. So that's a huge plus. There are many of the big insurance companies, they don't have a coverage issue, except that there are some employer self-funded plans under the insurances that they may be, but we don't see that problem anymore. So then I would probably just take the insurance issue, like not necessarily for covering or not covering, but at least making it standard that they all cover. But then if we talk about like what's morbid obesity, is it like the 35 or is it 40 or is it like 30 to 35? So that's a different issue. But in terms of the coverage, I think we are good. In terms of, this is actually tying, just tying that into the financial issues, there is really no financial impact on the patients. So this is, again, unless they may have a big, the deductible, that may be the case, but this is costing them on the long run a lot more anyway, being unhealthy. And, we were talking about in our diabetes session for the prevention, and when it's too late, and it's too costly. Too late is too costly. Like this is where we are today. So that's why that can not be an issue. I think the one that, as you mentioned, the lack of social support, the social stigma, and the one that is the fear and anxiety. I think that probably has a lot to do with some of our patients, because I see someone getting ready and just they're done. They're all like, and it's like 3 to 5, 6 months process, and how many different visits. Like just someone who's sometimes lazy to take care of his own health problems. Me, like it took 2 years to get one blood work done, and this patient did 18 different types of equivalent to the blood work, 18 different visits to the specialist, to the radiology, to the home sleep, like, all those things, and then yet at the end they are like, I'm not going to be able to go through. I guess this fear and anxiety is something that we probably need to look at. Is there any way that we can actually address that issue, or is it just like too personal that there's nothing we can do about it?
Well, I mean, clearly it's all about the proportions, right? I mean, there is always going to be a fraction of people that will be so anxious about the surgery itself that, they, even at the very end, they will, reschedule. I mean, I always talk about this episode way back when we started bariatric surgery. There was a patient who walked off the operating table. She just did. She did come back at a number of years later and have the surgery just because the problem was not solved. But this type of reluctance is just part of, it's natural, right? And some people will be reluctant. The question, obviously, that we're having here is that the number of people who are actually not going through the program is just substantial, given the enormity of the disease that they are facing, and also the fact that this is the most efficient treatment that we have currently, right? So I think educating our patients with sessions like this, for instance, people sometimes don't understand how much a program like this will go in terms of really educating people about these issues, Kemal. But it is precisely this type of the outreach that will have an impact eventually, right? Because it's all about education. It's all about understanding, right? I mean, it would have been, the best situation would have been for the person not to have the problem to begin with. If they were not struggling with morbid obesity, there would be no issue. And if we could manufacture a reality where that was the case, then obviously we would have been a perfect solution. But the reality is not that. The reality is they are struggling with a disease that could potentially be lethal, that is wreaking havoc in their quality of life, And we are saying, look, of all solutions that we've looked at, this is the best solution, and we're providing it in a setup that is very safe, that is has high quality, but it is nevertheless a treatment that has a certain level of invasiveness, and that by itself does carry unknowns, does carry potential for complications, and those are issues that create real anxiety in people's minds. And of course, that it is understandable. But at the end of the day, as healthcare givers, Kemal, we obviously cannot dictate treatments. All we can do is obviously present our case to them and say, look, these are the risks and benefits of this option. These are the risks and benefits of this option. This is what the evidence shows about the benefits. This is what the evidence shows about long-term outcome of staying obese. So we recommend this treatment for you. And we don't say that in a nonchalant way, Kemal. We obviously have a setup whereby we go through their medical issue. We sit in consultation to understand in depth their individual problem. And of course, we involve many other specialists in this process as well. It's not a coincidence that we have a cardiologist, we have a primary care doctor, we have a bariatrician, a nutritionist, and a psychologist in this process. It's because we want to increase also the understanding in the patient's mind that this is a very serious issue that involves so many specialists that are going to support this decision that they are making, right? Now, obviously, we have set up a situation where we have decreased to a really the lowest possible level, the potential for complications, right? I talk to my patients, obviously, about the risks of surgery, and I let them know, yes, life-threatening risks are not zero, they are a possibility, but we have placed measures that prevent these risks to a great level so that these risks are actually minimized to the lowest level possible, but it's not zero. And that is an understanding that they have. And when I present that, I also present the risks of staying obese. But very often, the risks of surgery are more immediate in their mind. The risks of obesity are more of a long-term issue, right? And the human mind cannot equate these two, and that's why many people have anxiety and fear about bariatric surgery, and then they don't go. But what we discover, as you perfectly know, Kemal, because you have the data in your hand, is that many patients who have dropped out this year will be coming back next year or will be coming the next day, right? So what they have done is they have prolonged their suffering with obesity. And the flip side of that is when you ask patients what they regret about surgery after they've lost the weight, after they become healthy, and they will tell you, my only regret is not having done this 5 years ago or 10 years ago or 15 years ago.
Absolutely. Now, last 12 months, about 400 cases we did at the American Surgery Center. So 398 patients out of 400 went home 6 to 8 hours after their surgery. Do you think that would help with some of the anxiety and fear?
Yes, definitely.
It's like they go home on the same day. And then those 2 patients who stayed, not because of the medical issues, they had some caregiver issues, so they asked to stay. So that's a really good, comfortable number, right? So if I know that I'm getting colonoscopy, right? So we know that we are going to be out. This is, I'm not saying that this is like colonoscopy, but it's the same day procedure. So you go home, I'm actually looking at one of the bariatric support group comments that had my surgery yesterday, got there just before 7 a.m., left at 4 p.m. Staff was so amazing. I feel pretty good. Gas pains definitely are uncomfortable, but they are eased up a little bit. So we didn't ask this person to post this. This person wanted to share this. And this is 99% of the cases. So, there's really, the fear is living with morbid obesity. That should be the fear, because that is not going to take us anywhere that's healthier or better life, right? So we have to find a solution to this problem. Yes, it's an undertake. It's a big undertake, and yes, maybe it's not so easy for everyone, but this is a solution. Again, like I mentioned this, this for a long time. I want to get a nose job, and that fear is enough for me to stop to get it, right? But if I know that there was a health issue, then I wouldn't even think about it, because it's one thing is the cosmetic, the other one is not, right? So
Absolutely.
that's like we want our patients to know that this is not like, because people are just saying, oh, you cut people's stomach. No, we don't. So right, so there's an incision, and there's and it's not how it was 20 years ago, and it's the same day procedure. Now, when you're in the hospital, it's not the same. You'll stay over. But when you're at the American Surgery Center, it's the same day procedure. You'll go home. Where most patients feel most comfortable when they're in their home setting, and they recover much quicker. And we know that this is the right way to get a better life and healthier life. So it's just like when we are done with everything, if someone didn't make their mind and just came for a consultant and they don't want to follow through, understand. But I think my issue usually is, I know that that person needs that last push. And what's that last push is, like, if I lost all the opportunities, if the surgical clearance is already done, so then surgeon cannot talk to them. Sometimes I try to call them and they don't want to talk to me. Because, I mean, that's probably fear, right? Or maybe they are embarrassed to change their decision. I don't know. But we really want to understand them. So if that's something, as you know, with the Surgery Plus, we have patients who are coming outside of Delaware, and their insurance is able to set up different, staying at a hotel and other types of stuff. So this is safe and common and so much needed. We have people outside of Delaware coming to get this. So if I have 3 Medicaid patients who change their mind after they finish everything, I'm like, I want to understand that. I want to know why. So tell me how I can actually help you. That's why I'm calling the patient if they are actually complaining about it. So maybe this is my way of just communicating. So that's like, we are not trying to force them to get the surgery, but I just want to hear, what is the problem? Is it a fear? Fine, I'll just put fear. But if it's not, and if it's just one more push, then we can be that. Because we know that, in the beginning, when I was telling all these people life-changing weight loss, we are talking about like half of their body is gone.
Yep.
That's a huge change. And it's not just so that you can be a supermodel. No, it's because for you to be able to live longer. And this is why we are here every week. And on top of our other, clinical events, we want to put this out there and then talk to the patients, make sure that patients can hear us. So hopefully we can reach out to more people with this and get to the, one other thing that you mentioned, Dr. Irgau, every time they stop the process and then they come back 12, 18 months later, they are 99% of the time they're heavier than where they left.
No question.
That's the other problem. So we don't want you to gain more weight because once you are at over 40 BMI, life is hard.
It is.
So
it is.
There's really, there are some miracles, but it's tough to, either you are going to maintain that or you are going to be gaining more.
Yeah.
So,
I mean, of all the factors that we know that are involved in encouraging weight gain, obesity itself is one of them. In other words, once you reach a certain level of obesity, that becomes a fertile platform for further weight gain, right? So it adds more impetus to weight gain. So as you said, people who are at a body mass index greater than 40 at some point, and you see them, 12 months, 18 months, 2 years later, invariably the weight will be higher, not necessarily because they are not doing as much as they could, it's because it's very, very hard. At that stage, it's not a question of losing weight, it's a question of maintaining even what you have. So invariably, when patients return for a second consultation, as you said, the weight will be much, much higher than it was.
Absolutely. All right. Well, Dr. Kemal, thank you so much for joining us. We'll be back next week with another topic, trying to bring you more data, new data. There are a lot of good stuff are happening. Us being at the point where we are at almost 75% completion rate is amazing, and we are extremely proud of that number. And then we want to actually improve, and that's one of the reasons that we are out here and talking to everyone and trying to give more information and give more education to those who may need and who are struggling with morbid obesity. So we'll be back next week. Thank you for being with us, and have a great weekend.